So thank you all and welcome to this afternoon's webinar. Today we're in the Stay in Control series, which is empowering patients to take control of their heart failure. Today is the second in the four-part series, and today's discussion is the symptoms you should not ignore. Do I have heart failure or am I just aging? Before we get started with the presentation, I just wanted to let everybody know that Mended Hearts' mission is to inspire hope and improve the quality of life for heart patients and their families through ongoing peer-to-peer support, education, and advocacy. You can reach us at all of the different websites below at mendedhearts.org, mendedlittlehearts.org, and myheartvisit.org. We also have a brand new Heartline that you can reach out to and get support and resources, and it's 1-844-HEART-87. So thank you all for joining us. We're so excited to have you here. All attendees are in listen-only mode. So if you cannot hear, hopefully you can read the slides. Please check the audio button on your personal computer to make sure the sound is on. That's typically the issue that we have. Please type your questions into the Q&A box at any time during the presentation. I will read your questions during the question and answer period. The presenter is not able to answer specific questions about you as a patient or your loved one, as he is not your treating physician. So please try not to ask very specific questions. And finally, the PDF version of the slides, as well as a recording of this presentation, will be available on the Mended Hearts website following the event. Today, I'm so honored to have Dr. Robert Capodilupo with us from the Medical Center in Manchester, New Hampshire. As I said, I am Andrea Baer, the Executive Director here at Mended Hearts, and I will be moderating the session. So now I am going to turn it over, and if you want to, you can just grab the controls and you can be on your.
Okay, great. Everybody can hear me well? Thank you. I'd like to thank the directors and Mended Hearts for inviting me to this webinar today. You know, it's always difficult because I like to read the audience and I can't read anybody's response here. So hopefully you'll pick up something from my talk and have some questions at the end. So, you know, when I sat down and looked at this, I was like, wow, this is a really good topic. You know, do I have heart failure? Am I just aging? I can't wait to hear. And then I realized, well, I'm the one who's got to put the slides together. So I think this is a great topic. I'm honored to be asked to do this. I've spent a lot of time trying to put these slides together. So we're going to talk a bit about, let's see, here we go. Congestive heart failure. Okay, my first typo, sorry. The pandemic, it's a common word these days. You'll see when we look at just some of the numbers, and a little bit about the epidemiology. Talk a little bit about cardiovascular changes as we all age. And then the very important question of symptoms to look out for. Symptoms you should know and symptoms that you should look out for. And then I'm going to talk just a little bit about the causes of heart failure, because I think that has a lot to do with symptom complex and do you or don't you fit into those categories of causes. And then the types of heart failure, because if you understand what's going on physiologically, I think you'll have a better understanding of congestive heart failure. So this is my obligatory incidence and prevalence slide. About 6.2 million Americans with heart failure. So a lot of people out there with congestive heart failure. I've been a heart failure doc now for about 15 years, and when I started giving this talk, I had a slide that said 5 million, then it changed to 5.5 million, and then 6 million, and these are the most recent statistics I could find off of the Heart Association website, Mayo Clinic, and Emory's website as well. So about 6.2 million Americans with heart failure. That's a lot, and 870,000 new cases each year. Used to be 500,000. Now it is 870,000. So a lot. We are busy as heart failure docs. Over 1 million hospitalizations a year just due to heart failure. It costs this country a lot of money, almost 31 billion with a B, still a huge number in care and medications and lost wages and lost time at work. The mortality, the chance of you dying from heart failure is high. Okay, the 5-year survival rate for all types of heart failure, anyone with heart failure, can be as low, survival rate can be as low as 50%, so 1 in 2. So that's important to know. So this is this is a common phenomenon. It's an important phenomenon. I do this every day at my work, and I'd love these talks to bring this information to the people, to the patients, to empower them. It is one of the most, if not the most common discharge diagnosis in patients over 65 years old. So, okay, very common, very scary. What is it? What is congestive heart failure? So this is really a textbook definition, inability of the heart to meet the metabolic demands of the body, right? Your heart pushes oxygenated blood to you so you can walk, so you can talk, so you can move your arms and eat and digest and think and all the other great things that you do. But heart failure means the heart just can't keep up with those demands. So it's a syndrome. Okay, heart failure patients have volume overload. They have fluid, excess fluid that backs up in their body. They have trouble breathing, and especially trouble breathing with exercise. And they have reduced exercise tolerance because of that. And the causes that we'll go over in a little while in this talk, it may be systolic. You may hear this from your doc. You have systolic dysfunction, and easy way to remember that is the S in systolic. That's really the squeezing function of the heart. Or diastolic, which is a little more difficult. That's the relaxing function of the heart, and we'll get to that as well. Okay, so congestive heart failure, it's a term some people title their talks living with failure or making success out of failure. So it is congestive heart failure, failure of the body, of the heart, to meet the metabolic demands of the body, but we're going to try to see if we can change the trajectory of this as best we can. And it's important in this age group. This is older data, certainly from the latter 80s to early 90s, but as folks get older, the incidence of heart failure increases. And over 75 years old, you have over 10% of the population in newer numbers suffering from congestive heart failure. And this is not going away. This is a study that was put out in Circulation Heart Failure a little while ago, American Heart Association data, that the number of patients with heart failure will increase almost 50% by the year 2030. So here we are here. Congestive heart failure continues to rise. Men in blue, women in red. Women do not escape this data set. Okay, women suffer heart failure as do men. And the number of patients diagnosed with heart failure will rise to about 8 million, will be that slide, in less than 10 years from now, about 1 in every 33 people. So it is common, it is frequent, and looks like it's here to stay, and it's increasing. So let's learn a little bit more about it. And I stole this slide from Gary Larson, who does not like us to use his slides for medical things, but I thought this was very important to know. I thought it was funny, but I think here we are as healthcare providers, and we have patients who come to us and they have heart attacks, or they have high cholesterol, or they have valve disease, and what do? We save these patients, but they bounce into the burning building of chronic congestive heart failure. So we really have to put a lot more of our resources into this, and this is happening across the country, if not the world, a focus on heart failure. And finally, heart failure by state. I understand that we have folks across the country here, and in the privacy of your own Zoom meeting, you can plot where you are on this map. The darker, much higher incidence of heart failure than the lighter. The white blocks here have very, very little heart failure. The darker reds have higher amounts of heart failure. Here's Alaska and Hawaiian Islands. I'm up here in New Hampshire, and there's a fair amount, and there's a lot more down in the lower parts of the state, of the country. So that's congestive heart failure. So this is a talk about, am I aging or is it heart failure? So I thought I'd spend a little time with what happens when you when you get older, okay? I see patients in the clinic all the time and they say, well, doc, you know, I am getting older. And I ask everybody about their activity, everybody. And a lot of folks say to me, a lot of my patients say, oh, I don't know, I'm just getting older or what? So what's normal aging? Because I tell them I can't do anything about you aging, right? We're all aging. But what happens when we get older? So the cardiovascular system changes as we get older. Our blood vessels get stiffer, okay? They're not as pliable. Okay, we are just not as pliable as when we were kids running around and jumping up and down on the jungle gym. Okay, our blood vessels are the same way. They get stiff. As those pipes get stiff, they don't expand. And when they don't expand, the heart has to work harder to pump the blood through those stiffened vessels. As the heart works harder, the blood vessels get stiffer, you increase your risk of high blood pressure. That's why you see so many folks with high blood pressure as they get older, about 30% of the population. That's a lot of people in this country with high blood pressure. And a lot of it is just simple physiology. The blood vessels get stiffer, the heart works harder. As you get older, your systolic, which is the upper number, will often increase, and the diastolic, which is the lower number, will often decrease. And the difference between the two is called the pulse pressure, and that's also a significant risk factor. So bottom line, if your systolic pressure, the upper number, increases, that's a warning sign, and you really should see your doctor and get on medications if needed to bring that down. And finally, increased stress on the heart causes the heart to increase in mass, otherwise known as hypertrophy, because it's trying to push through that pressure, okay? And hypertrophy is not good over time. You can also start to get scar tissue just as the heart gets older and as some of these older muscle cells that you lay down become not as pliable as above. As the heart gets thick and as it gets hard and scarred, it's hard for it to relax. And if it doesn't relax, it's hard for it to fill. And if it doesn't fill, it doesn't eject. You also have conduction fibers through your heart, and you start to get heart rhythm abnormalities as you put more stress on the heart and as you form scar tissue. And then you start to get calcification. Anybody who knows of degenerative joint disease or calcification, etc., arthritis, calcification is extreme fibrosis, and you can get fibrosis in the muscle as well as the valves themselves. So the earliest symptoms of heart failure can be subtle in people, but it's dangerous to ignore them. We want to be proactive and not reactive. I say that all the time in my heart failure lectures. So what are these symptoms? What is the important part of this talk here? Common symptoms of heart failure. Shortness of breath would be the first one, okay? I say to patients, are you short of breath? Well, you know, I get short of breath when I walk up a flight of stairs. But my question is it worse than it was before? Is it progressive? That's the important part to remember, okay? Many people may get a little tired if they walk up a flight of stairs, but is it significant? Do you have to stop? Do you have to stop halfway? Do you have to stop at the top and say, whoa, boy, let me just wait a minute, I got to catch my breath here. I always ask people a flight of stairs because we all know what a flight of stairs looks like. Some of my patients say, well, doc, I'm really short of breath when I go to my mailbox. And I say, wait a minute, let me see what your driveway looks like. No, you know, I have no idea, right? Oh, it's true, I get short of breath when I walk up a hill. That's very important, but how big is this hill? How long is this hill? Okay, I like to ask a flight of stairs. That's a good one. Swelling, lower extremity swelling, very, very common in heart failure. And I'm not talking about the little sock ring. A lot of patients pull their pant leg up and say, hey, I got this little ring here. I'm talking about leaving a dent, okay? That's swelling. Chronic lack of energy, just can't do what you previously did. Difficulty sleeping, very important. I wake up short of breath in the middle of the night, a very important symptom for us. Swelling or tenderness of the abdomen or early satiety, which means I just can't eat as much anymore because I just feel like I'm bloated or just kind of loaded with fluid, okay? A cough that doesn't go away. You're not bringing up some miscolored sputum. It's not a pneumonia. It's not a bronchitis. Sometimes it's just frothy and clear. Up a lot urinating at night or problems with just thinking, okay? So it's all about fluid recognition, okay? Can you hear me now? That old famous line that we used to hear, okay? It's about fluid recognition in patients and about fluid recognition in you, okay? So this is Ralph Netter, the famous medical illustrator, okay? Dr. Netter, who is just a fantastic artist. And patients who are sitting there, they have a tough time breathing. This is someone with advanced heart failure. He's sitting up so he can get the fluid to go down in his body so he can breathe. People at this stage are quite advanced. You may see protrusion of neck veins. If you see protrusion of neck veins, not when you're talking, but just sitting there with normal breathing, and these are protruded, that's a sign of heart failure. And the most common one is swelling of the legs. And here, this person just pushed their thumb in there and they leave a dent. That's what we're talking about, leaving a dent. So very, very, very important. So do you have heart failure? Is it possible? Well, is your energy level normal? I mean, all our energy levels get lower and lower as we get older, right? I'm getting older too. My energy level's going down. Is it what it used to be? Comparison, right? To last year, to last month. Are you short of breath with usual activities? Do you have a bedroom upstairs? Do you travel upstairs every day? Usual activities making you short of breath. Are your clothes too tight? Are your shoes too tight? Shoes are a good one because that's more lower extremity swelling. Clothes, maybe a function of your diet. Shoes, can be diet, but oftentimes will be fluid, right? Coughing more than usual, maybe a wet cough. And then when you lay down, when you stand up, the fluid may go down to your legs, but when you lay down, right, water seeks its own level, and that water can get back up into the lungs, and that's why you get short of breath when you lay down. One of the most important things I can tell you, one of the most important things, these symptoms are important, and the second most important thing is going to be the onset. Are these changes sudden or are they acute? So I've been getting short of breath. I've been getting more and more tired over 10 years. Okay, but if you say, wow, boy, getting short of breath over the past month or a couple weeks, that's not older age. Something is going wrong here. All right. This is from the Heart Failure Society of America website, the FACES acronym. Throwing a lot of things at you. Oh, doc, how can I remember all this stuff? The FACES acronym, F-A-C-E-S. FACES. F for fatigue. Heart can't pump enough blood, like we said. Fatigue sets in. A, activity. Activity limitation. I'm just unable to keep up with normal activities. Not running a marathon. Normal activities. I used to be able to do that. I can't anymore. That should be another red flag to you. C for congestion. Fluid builds up. Where does it go? It goes in the lungs. You cough, you wheeze, you're short of breath. E for edema. Same thing. Congestion in the legs. Edema is a fancy medical term for ankle swelling or leg swelling. Starts in the ankles and it builds its way back up. You see it in the shins. You see it in the knees. Back up into the legs. And finally, S for shortness of breath, fluid in the lungs that limits breathing. This is all because of congestion. C, E, and S are really all the same. So F-A-C-E-S, keep an eye on that. This is important because this is lower extremity swelling, okay? You push your finger in, you pull your finger away, you leave a dent. Okay, that's why I like this slide. Some patients just may accumulate size in their legs, okay, right? But if you're pushing and you're leaving a dent, that's not good. That's lower extremity swelling, okay? Put on a few pounds, but mostly water weight, okay? That's fluid down there, okay? But symptoms of more advanced heart failure, this is a lot in one slide. And we talk to all of our heart failure patients. I run the heart failure clinic here. You gain more than a couple pounds in a day, that's not fat. That's got to be water. 5 pounds in a week, that's got to be water, okay? You're tired and weak. How about dizziness, lightheadedness that goes along with the fatigue? We talked about shortness of breath. Shortness of breath when sitting, hey, I'm not even exerting myself here, and I'm short of breath. Yeah, that would be concerning to me. If you wake up in the middle of the night gasping for air, that's a warning sign. If you say, yeah, I used to be on one pillow, but now I'm on two. No, now I'm on three. Now I'm almost upright at night. Or my famous patients who just sleep in recliners because they can sit up a little bit. haven't been in their bed for months, if not a year, because they can sleep so much better in their recliner. Okay, if you wake up after you fall asleep because you're short of breath, and as I said, that fluid reaches the same level and it backs up into your lungs. Pain or pressure in your chest from fluid overload. The cough that just doesn't go away, we talked about that. Foamy, pink, hacking. Swelling in your feet, we talked about. Frequent urination, stomach pain, or maybe even irregular heartbeat. All very, very important signs of more advanced heart failure. So don't neglect. In elderly folks, the most common signs are going to be these: shortness of breath, fatigue, irregular heartbeats. Either you're too fast, too slow, or they just go boop, 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 irregular. Chest pain, pressure, dizziness. All of the above can be due to an acquired cardiac cause that can leave you with heart failure. So do not neglect these symptoms. So that's really the bulk of the talk, but I just wanted to give a little bit more background so we understand heart failure just a little bit more. Okay, those are the symptoms you should look for versus getting older, and again, the onset and the acuity of the symptoms. But what do docs mean when they talk about heart failure? There's two types. Systolic, I said squeezing, SS, squeezing function of the heart is down. You just can't pump the blood out. Your heart's often dilated and it backs up. And where does the blood back up into? The next chamber, proximal, which is the lungs, which is why you get short of breath and why you get a cough. Or you can have diastolic, which means your heart doesn't relax. And a lot of people are like, wait a minute, I get the whole pump thing and the pump's not working. But what do you mean it doesn't relax? Well, the heart's thickened, and if it can't fill, it can't eject. Backup of blood goes into the lungs, just like above. This is the most common type of heart failure in the elderly. Over 2 million Americans just have diastolic dysfunction. And if you say to yourself, geez, I don't get this diastolic thing, I put a picture of a water bottle here. For those of us old enough to remember the water bottle. And remember some of those Mr. Olympian, Mr. Atlas, they try to blow up a water bottle. You can't. It's thick. It's thick rubber. That's diastolic dysfunction, okay? Does this hold gallons and gallons? No, because it will not expand. It will not relax. You can't fill a big water bottle a lot. You can just put a little bit of fluid in there. Try to blow one up. That's diastolic dysfunction. So initial testing, okay? Echocardiogram is key. Very, very, very important, okay? You may say, hey, maybe you just got an arrow through your head, but let's order a bunch of tests. This is just because docs need to know. Is it diastolic or systolic dysfunction? It's ultrasound. It's painless. I will be able to tell the difference if your heart doesn't squeeze or if it doesn't relax or if there's a problem with one of your valves, because that's going to be important as to how we treat you. So I hope these move for everybody. These are transthoracic echocardiograms, and some of you may have undergone an echocardiogram. This is your left ventricle and your right ventricle and your left atrium, your right atrium. But what's important to know is if you put your eyes on the inside here, and I do this every day, this heart's squeezing normally. Okay, if he says so. But you look over here, this is an abnormal heart. I mean, look at this, right? This is not squeezing. This is not squeezing like that one. This is diastolic dysfunction. These patients both come in short of breath. How do you know who's got what? This is systolic. I mean, look at that pump. There's barely even any motion over there, right? Right ventricle, same type thing. So just want to show some cool images because that makes the talk. Anyway, that's systolic dysfunction. That's diastolic dysfunction. And you may have what's called an enlarged heart, and you just can't squeeze out, systolic dysfunction, or your heart may look normal, diastolic dysfunction. Now, finally, in the next few minutes, what causes heart failure? Okay, if you want to talk about symptoms, you want to talk about symptoms that are important, you might want to say to yourself, am I even in the right wheelhouse here? Well, the number one cause is coronary artery disease. Why is that? Because coronary artery disease affects more men and more women than anything else in the world. Okay? You get damage to your heart from a heart attack. Okay? And if you damage that pump, it's not going to work as well as it did before. Okay, it may not be reversible, but it's treatable. And the most important part of this whole list is we want to treat those things we can treat, and we want to reverse those things that are reversible, or else us docs are not doing our job, right? We want to reverse what we can reverse. High blood pressure, we talked about a little bit, very important. If you have a valve, okay, there's a bunch of one-way doors in your heart. That's how the blood gets in and gets pushed back out. The one-way doors, if those one-way doors aren't opening, or if they aren't closing well, then you have a valve disorder. You could have a rhythm problem. We talked about irregular heart rhythms. Could be a viral infection, could be alcohol, right? Alcohol is a direct toxin to the heart. Maybe a glass a day is good, but too much alcohol, bad. Anybody who's had chemotherapy in the past, there are certain chemotherapeutic drugs that are toxic to the heart. Iron overload can be toxic. Thyroid abnormalities can be toxic as well. So number one is coronary artery disease. Make sure you don't have a heart attack. I always put this on here. I tell folks you can plot where you are in the privacy of your own thoughts. But here you are from your first decade, your third decade, oh my gosh, this is what happens. This is the atherosclerosis timeline. And as all this fat and lipid collects, this is a cross-section of an artery, blood goes through here in your heart, and when this stuff gets too big, what happens? Boop, you close off the flow. That is a heart attack, okay? And this is to scare all of us to say no to the French fries and have the salad instead. So that was a scary slide. You know, what's the key? The key is prevention, right? We don't want to go down that road. We don't want to go into heart failure. We don't want to have those symptoms. Make sure you try to prevent a heart attack. Keep your cholesterol down, blood pressure down, diabetes, and tobacco, okay? Other causes that we talked about, I'm going to go over those one at a time here. Valvular disease, stenosis is a narrowing of the valve. We talk about this. Your doc may say you have a stenotic valve. That's just fancy medical lingo for a narrowing of the valve, which impedes blood flow. You could have a regurgitant valve, which means the one-way door doesn't close all the way, so the blood gets shot out and it comes back in. It's shot out, one back in. I say to my patients, it's like bailing out a boat, and you're throwing the water on a slide and it's just coming right back in the boat, okay? This needs to be fixed. Valves need to be fixed. Either they get repaired or they get replaced, okay? And you go and you visit your friendly neighborhood surgeon, okay? Other reversible causes, irregular heartbeats, okay? Is your heart racing? Do you feel palpitations? Always ask patients that, okay? Atrial fibrillation, you may have heard the term atrial fibrillation, the most common sustained arrhythmia in the world, that should say. In the world, most common sustained, atrial flutter, or even extra beats from the bottom of the heart. You will often wear a monitor to quantitate that. So if you have symptoms of palpitations, bring that up with your doc, okay? Be proactive, reduce your risk factors, exercise, heart association, 150 minutes a week. Seems like a lot, right? Just 30 minutes a day for 5 days out of the week. I'll give you 2 days off a week, I tell my patients, okay? Make sure you're doing a little workout there. Keep it brisk. And I love walking. I tell patients it's available everywhere. You don't need to join a gym. All you need is a good pair of walking sneakers. That's it. And usually it's free, okay? It's essential, okay? Just rolling around, tossing and turning in bed is not exercise, okay? You got to get out there. It's critical for patients with heart failure, okay? Reduce your risk factors. Eat right. Avoid excess fats, cholesterol, fried foods, as I mentioned. Eat fruits, vegetables, low-fat dairy products, skinless poultry and fish. If you have heart failure and you're listening, but you do have heart dysfunction, avoid excess salt. I tell my patients, just remember the number 2. 2,000 milligrams a day, 2 quarts total of fluid. And this you can get on the back of every label. Just add them up. And when you hit 2,000, you're done, okay? If you go to some place, they say, hey, our fries have half the fat, doesn't mean you can get 2 bags of fries. I like to use a car analogy with all my patients, okay? I'm a big car nut. This was an old Bugatti that was found somewhere in London. They said it's one of the most expensive, rare cars in the world. Stay active, and you know how the machine's running, okay? Patients, I'll ask all my patients, what do you do for activities? And if they sit in front of their TVs with their clickers, I don't know how their machine is running. Okay? They could be like a car in a garage. You have no idea. If you folks want to drive, right? I live in New Hampshire, and we got a lot of patients who go down to Florida for the winter. And if you say to me, hey, I need a car to go down to Florida, are you going to pick this one that's been in the garage for decades and decades? Maybe worth a lot, but who even knows if it runs? So when my patients say, yeah, I sit on the couch, I watch a lot of TV, I have no idea how well your machine is running. But if you say, yeah, I drive 200 miles a day in my car and it runs great, then I know that your heart must be doing well. That's why exercise is so important. And I ask everyone every day, what are you doing for activities? Continue to be proactive. High blood pressure. This is, the silent killer, okay? 1 in 3 folks, I said, in our country, in America, has high blood pressure. Know what your blood pressure is. Control it. Keep it down. 130/80. Okay, more than that, that's stage 1 high blood pressure. Okay, this is American Heart Association data. Aerobic exercise. Get out there and walk. Stay away from salt. Stay away from significant alcohol. And if you lose weight and you exercise and your blood pressure is still elevated over these numbers, then see your doctor as needed. Diabetics, glucose is a endothelin toxin. It will cause problems with that picture of the coronary artery that we looked at. You need to keep your glucose under control. It is a significant risk factor for heart failure. Okay, exercise, diet, keep an eye on that hemoglobin A1C. And finally, know your cholesterol numbers, okay? And if you cannot get that cholesterol down, you may need medications to help. So keep an eye on soluble fiber, fruits and vegetables, spices, okay, unsaturated fats, and your sugars. All of us, okay? Eat less sugars, more unsaturated fats, spices, fruits, vegetables, and soluble fiber. And then finally, this is an easy one. Stop smoking now, right? That's an easy one. And it always amazes me the price of a pack of cigarettes, how much it is. To say to some of my patients, wow, look how much money you will save if you stop smoking. So in conclusion, because I'm going a little bit over my time here, CHF is common and it's increasing, okay? So it's out there. And we're doing the best we can to treat folks. It's important to know if you have heart failure or not, okay? More than 10% of elderly patients have congestive heart failure, all right? Some of it's part of the normal aging process. Some of it is injuries to your heart like heart attack. Some of it, folks just get a stiffer heart as they get older, okay? Symptoms to watch out for. We talked about them. We talked about lower extremity swelling. We talked about shortness of breath, chest discomfort, palpitations, troubles lying flat. These may be 5 of the bigger ones, okay? Those are the symptoms, really, that this talk is all about, okay? And I wanted to add really the sudden or significant progression in these symptoms is what you want to be aware of, okay? I never had swelling in my legs like this. I really never had this much trouble going up a flight of stairs. Hey, chest pain at any time is something that you have to report. Heart racing at any time is something we need to know about as well. As folks get older, the increased risk of just a stiff heart. So get an echocardiogram and see, is your heart stiff? Does it squeeze well or not? Because diastolic dysfunction is common in the elderly and it's difficult to treat. Difficult to diagnose, difficult to treat, okay? Systolic dysfunction, the squeezing, there are a lot of good medications out there and you really should be on them. If you have a heart that doesn't squeeze well, make sure you are on medications that have been shown throughout the world in multiple trials to help people live longer and feel better. And finally, take care of yourself. That's a simple one, right? We all of us, I'm listening to this too. We all got to eat right. We all got to exercise. We all got to make sure our blood pressure is under good control. We should all be getting cholesterol values from our docs. We should manage stress. That's an easy one for me to say, okay? It's tough for all of us, okay? If you smoke, please stop smoking, get enough sleep, make sure that you're not burning the midnight oil. And remember, the best defense is a good offense. In the olden days, I would have said, trust me, I'm a doctor, but you know, some of those old advertisements, they just don't hold true anymore. And I wanted to thank everyone again for your time, for your interest in my lecture here, and we can go over some questions. Thank you.
Thank you so much. That was great. So I have about 4 questions that are teed up already, but I do want to let everybody know if they have questions to please put them in the question and answer portion of the website or of the webinar, and we will get to them in just a moment. But for now, one question I have is my feet swell significantly when I travel. Does that mean I have heart failure, or is that a problem with my heart?
That's a good question. Remember, if you're sitting down, most of us are right now, and your legs are bent, like most of us are right now, as you bend your legs, you're going to decrease the what's called venous return, or the blood return from your legs. So a lot of folks get swelling if they're sitting for long periods of time, which includes traveling for long periods of time. A lot of normal folks will get swelling at the end of the day, and then when they're lying flat, and again, the water seeks its own level, it goes away by morning. So again, something to watch, something to keep an eye on. If you leave a big dent in those legs, as we showed in that slide, then you may just want to check with your doc and make sure your heart function is good. But a little swelling, sitting for long periods of time, or sometimes being on your feet for long periods of time and just standing will cause stasis and will cause swelling.
Great. And so how does drinking red wine impact heart failure?
The French paradox. That's a great question. You know, it's tough as docs to tell everybody, you know, hey, you got to go out there and drink, right? And there's still a lot of doctors who have a little trouble with that. But if you read the guidelines, you have 2 a day for a guy and 1 a day for a gal. It seems to be where the data is. If you drink excessively and you have heart failure from alcohol use, then I tell my patients you got to abstain, period. None, 0. Number 2, if you have a very weak heart, like that echocardiogram I showed, that ultrasound where you saw that yellow heart that barely moves, then I would abstain from alcohol as well. So if you have really bad pump function, then I abstain. Otherwise, 1 a day, I'd say to my patients, 1 a day right now is supposed to be okay for you.
And then finally, before I turn it over to the Q&A section, you talked about systolic versus diastolic blood heart failure. We hear a lot about reduced ejection fraction and preserved ejection fraction. Could you explain which is which and which correlates with the systolic and diastolic?
Sure, that's good. Sorry, but I probably should have put that in my slide. Make a little note here. So heart failure with reduced ejection fraction is systolic. So systolic, a problem with squeezing, same thing as heart failure, reduced ejection fraction, or HFrEF. If you put all the letters together, some people call it HFrEF, heart failure, reduced ejection fraction. So reduced ejection fraction is systolic, and that's important to know because there are several medications that have been shown, you know, since the 90s now, which is a long time ago, to reduce your chance of dying and reduce your chance of ending up in the hospital. So they improve your survival and they improve your well-being and they make you feel a lot better. Those are so important medications. That's why I stress if you have heart failure with reduced ejection fraction, it's important to know because you want to make sure you're on those medications that are going to help you live longer and feel better. HFpEF, heart failure with preserved ejection fraction, HFpEF, HFpEF, preserved ejection fraction, is the diastolic dysfunction. There have been a lot of studies looking at medications with diastolic dysfunction, and we just haven't found any good ones yet. That's the tougher one.
Right. But there are now monitoring systems, right? Like the CardioMEMS, that's good for both the HFrEF and HFpEF. Is that correct?
Correct. Yeah, we're a big CardioMEMS implanting site, and the CardioMEMS device is really one of the only modalities that has been shown really to impact heart failure with preserved or HFpEF population. You may decrease hospitalizations by as much as 50%. So very, very important in that group. Absolutely, in the HFpEF population.
Great, great. Thank you so much. So I am going to turn it over to Leslie, who is going to moderate the questions out. Leslie, do you have those questions in chat?
I do. So the first question is from James. If part of the strategy for treating congestive heart failure is taking a load off of the heart, why is exercise, which causes the heart to work harder, good for a congestive heart failure patient?
That's a great, great question, James. The theory is that the heart does work harder during those times, but the heart will start to work actually more efficiently because the muscle fibers in the heart will start to build and will actually use oxygen much more efficiently than otherwise. So you're getting, if you exercise for half an hour a day, then your heart will be feeling better for 23 and a half hours a day. So yes, you're putting stress on your heart for 30 minutes, but you're going to get benefit for the other 23 and a half hours. That's why I tell patients aerobic exercise. That's why I tell patients walk, 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 and walk, okay? Don't lift weights. If you're out there in the gym, and you're stressing to press 200 pounds, that, my friend, is putting stress on your heart, and that's bad.
All right. And the next question is, what triglyceride level should we shoot for?
It depends on your lab. All labs are different. You know, I think our lab is less than 150 to 200. I'm in New Hampshire. We're close to Dartmouth. I think Dartmouth's lab maybe 2 to 250. So it depends on what the normal is for your lab. And hypertriglyceridemia or high triglycerides are part of the cholesterol panel that you get, and high triglycerides on their own is a risk factor for heart disease as well. You could have just hypertriglyceridemia, which means your cholesterol panel is great, except you have very, very high triglycerides. So make sure when you go over it with your doc or you get your results in the mail, you know what the normal is, and make sure you're well within normal, because triglycerides themselves are bad as well.
Any other questions in the chat box, Leslie?
That's it in the Q&A.
All right, excellent. So if anybody has questions, here's your last minute chance to get them answered. In the meantime, I just want to remind you all that next Thursday, April 22nd, at same time at 2 o'clock Eastern, we have the next session in our series, Living and Thriving with Heart Failure Today. This is not your parents' heart failure is the title. So it's going to be great talking about all of the wonderful innovations that are happening in heart failure and how it can help you live and thrive with heart failure. So make sure to mark your calendars and come back to see us next week for the next session. And we will give one last check of the Q&A, and I don't see any more questions. So Dr. Capodilupo, thank you so much for joining us. We really appreciate it. And everyone who is watching, have a great day, and we'll see you next week.
Okay.
Thank you.
Bye.
Thank you. Thank you.